all legal Virgin Islands residents can expect to benefit from the implementation of a national health insurance plan sometime later this year. However, government is yet to disclose the percentage of contribution that individuals and employers will be required to pay when the plan is launched. Antoinette Skelton, the director of the BVI Social Security Board, speaking on JTV's Speak Your Mind, aired on February 23rd, hinted that the rate would be reasonable, but stopped short of disclosing what the required contributions would be.
We don't have a percentage as yet. We have a recommended percentage based on the financial model that was done by the actuary, but that's a recommendation. The government will decide the percentage. I don't want to preempt government from making this decision, but you asked about 10 and 20, it's going to be lower than 10.
Speaking at the first Government on the Road meeting held in Carrot Bay on Monday, February 25th, Minister for Health and Social Development Ronnie Skelton said the National Health Insurance Plan is necessary to help middle and low-income earners have access to health care services.
The insurance companies, they see it as a threat to their survival. But I don't see it that way. I see where there will always be a higher level of reinsurance that is required, that they will play a part in, but we cannot continue to leave the health of the very people, the unfortunate ones in our society, to the mercies of the health insurance. As the people and the government, we have to do something, and we feel that this is for the greater good. So that's why we're making this decision and traveling this road.
Once implemented, the NHI will be operated by the Social Security Board and will be funded through a combination of government budgetary allocations, employer and beneficiary contributions, co-payments, surcharges, and interest earned on the NHI fund reserves. Kishma Barnville, National Health Insurance Manager of Beneficiary and Advisory Services, says the NHI is intended to support local health services. However, where there are limited services, she advised that the plan will allow clients to access healthcare services off-island when necessary.
There's a limitation as to what services are available anywhere in the world, for that matter. So we know our limitations currently, so we will seek to enroll persons within the provider network of the National Health Insurance so that persons do have coverage off-island when necessary. And it must be medically necessary for those services to be accessed off-island.
Responding to concerns about the role of private healthcare providers, Barnville says local providers are encouraged to participate in the National Health Insurance Plan.
While the private providers are going to be invited to join, they're at will, whether they will or will not, coverage or access to healthcare on island, whether or not they have enrolled within the network, will not be denied. There is a possibility of a higher co-payment for those services locally, but you will not be denied access to medical care because of that.
The National Health Insurance is a division of the Social Security Board. The plan is expected to facilitate the reinvestment of funds into improving health care in the territory. In his 2013 budget address on November 15, 2012, Premier Dr. Orlando Smith cited the need for restructuring the health financing system to provide equitable coverage for all the people in the Virgin Islands. Discussions about the health insurance plan have been held here since 1986.